Hey everyone, and welcome back to Study Nurse IQ. I'm Jeannie, and in this video we're tackling a major topic you'll see in nursing school, on the NCLEX and throughout your career: heart failure. This condition is a super common diagnosis on the medical surgical floor, so you'll need to know it inside and out. We'll break down the types, symptoms, treatments, and nursing care, and I'll even give you a quiz at the end to test your knowledge. Let's get to it. What is heart failure? At its core, heart failure, HF, is when the heart muscle can't pump enough blood to meet the body's needs. This isn't a heart attack. It's a chronic condition where the heart is overworked and becomes less efficient. The pathophysiology usually starts with another condition, like coronary artery disease, that damages or overworks the heart, leading to a decrease in cardiac output. Systolic versus diastolic dysfunction. To really understand heart failure, you need to know there are two main categories. It's a problem with either the heart's ability to pump or its ability to fill. Systolic dysfunction. Think of this as a problem with the pump itself. The heart muscle is weak and can't contract forcefully enough to push blood out. This leads to the heart chambers stretching out or dilating and a low ejection fraction, which is the percentage of blood pumped out with each beat. In systolic dysfunction, the ejection fraction is less than 40%. The causes are often from damage due to things like a prior heart attack, hypertension, or a faulty valve. Diastolic dysfunction. This is a problem with the heart's ability to fill. The heart muscle becomes stiff and can't relax to fill with enough blood. The key here is that the heart can still squeeze, so the ejection fraction is often greater than 50%. However, because it started with less blood, the total amount of blood pumped is still not enough for the body. This is often caused by chronic conditions like long-term hypertension. It's important to remember that in advanced heart failure, patients often have a combination of both systolic and diastolic problems. Left-sided versus right-sided heart failure. Now let's talk about the clinical signs you'll see. To understand the symptoms, just think about the heart's blood flow. Blood comes into the right side from the body, goes to the lungs, then to the left side, and finally out to the body. Left-sided heart failure. When the left side fails, blood backs up into the lungs. This causes pulmonary congestion. You'll see symptoms like dyspnea, difficulty breathing; crackles, sounds like a crackling noise in the lungs; pink frothy sputum; fatigue. Right-sided heart failure. When the right side fails, blood backs up into the rest of the body. This causes systemic congestion. You'll see symptoms like peripheral edema, swelling in the legs and feet; ascites, fluid in the abdomen; jugular vein distension, JVD; hepatomegaly, enlarged liver. I like to use this simple memory trick. Left-sided failure equals symptoms in the lungs, and right-sided failure equals symptoms in the rest of the body. NCLEX classification, symptom-based. This system classifies patients based on their current level of physical activity and symptoms. Class 1. Patients have cardiac disease but no limitation of physical activity. They are comfortable at rest and with ordinary exertion. Class 2. Patients have a slight limitation of physical activity. Ordinary activity causes symptoms like fatigue, palpitations, or shortness of breath. They are comfortable at rest. Class 3. Patients have a marked limitation of physical activity. They are comfortable only at rest. Even less than ordinary activity causes symptoms. Class 4. Patients have symptoms even at rest. Any physical activity increases their discomfort. Key diagnostic tools. There are a few key tests you need to know for heart failure. HbNP. This is a hormone released when the heart is stretched from fluid overload. A level over 100 pdring per milliliters is a strong indicator of heart failure. Echocardiogram. This diagnostic tool is used to measure ejection fraction, which we just talked about. A normal ejection fraction is 55 to 70%. Anything under 55% is a key sign of heart failure. Hemodynamic monitoring can also be used, which will show an increase in central venous pressure, CVP, and pulmonary artery wedge pressure, PA, due to the fluid backup. Heart failure treatments. Now let's talk about how we treat heart failure. The goal is to improve the heart's pumping ability, reduce fluid overload, and decrease the workload on the heart. We use a combination of medications and, for advanced cases, other interventions. Medications. These medications are the foundation of heart failure management and are often used together to achieve the best results. ACE inhibitors, ACI. These medications block the production of a hormone that narrows blood vessels. By keeping the vessels open, they reduce the pressure the heart has to pump against, making its job easier. Diuretics. Sometimes called water pills, diuretics help the body excrete excess fluid and sodium through the kidneys. This reduces the fluid buildup in the lungs and body, easing symptoms like shortness of breath and swelling. ARBs, angiotensin II receptor blockers. ARBs work similarly to ACIs, but by a different mechanism. They block the action of a powerful blood vessel constrictor, helping to widen blood vessels and lower blood pressure. They are often used if a patient cannot tolerate an ACI. Beta blockers. These drugs block the effects of stress hormones on the heart. They slow the heart rate and reduce its force of contraction, allowing the heart to beat more efficiently and rest. Advanced treatments. For patients with very advanced or end-stage heart failure, medications alone may not be enough. BIVAD, biventricular assist device. This is a mechanical pump that is surgically implanted to help the heart pump blood to the body. It supports both the left and right ventricles. A BIVAD can be a bridge to transplant or a long-term solution for patients who are not eligible for a heart transplant. Transplantation. For some patients, a heart transplant is the only definitive cure. This involves replacing the failing heart with a healthy donor heart. Hospice. When heart failure becomes refractory, unresponsive to treatment, and a transplant isn't an option, hospice care focuses on comfort and quality of life rather than curative treatment. Nursing care. In terms of nursing care, we're going to want to closely monitor the patient's weight on a daily basis, and we're going to want to monitor their I's and O's as well. We're going to want to sit the patient up into high Fowler's position because it'll be easier for them to breathe in that position. We may also need to restrict the patient's fluid and sodium intake as ordered, and then we always want to monitor for complications such as pulmonary edema. All right, let's put your knowledge to the test with 3 quick questions. Question 1. A patient with a history of long-standing hypertension has been diagnosed with heart failure with preserved ejection fraction. The nurse recognizes this patient has which type of heart failure dysfunction? Asystolic dysfunction, diastolic dysfunction, C. Left-sided heart failure, D. Right-sided heart failure. Correct answer, diastolic dysfunction. Rationale. Diastolic dysfunction is characterized by a stiff heart muscle that has trouble filling, often caused by chronic hypertension. The ejection fraction is typically preserved over 50%, but the total output is still reduced. Question 2. The nurse is reviewing the lab results for a patient admitted with a suspected exacerbation of heart failure. Which finding most strongly supports this diagnosis? A. A potassium level of 4.5 milliliters. B. A chest X-ray showing an enlarged heart. C. A blood glucose level of 110 milligrams per deciliter. D. An HbMP level of 450. Correct answer D. An HbMP level of 450. Rationale. An elevated HbMP level above 100 pg/ml is a key diagnostic marker for heart failure, as it indicates the heart muscle is being stretched due to fluid overload. Question 3. The nurse is providing education to a heart failure patient. Which of the following medication classifications is known to reduce the workload on the heart by helping to widen blood vessels? ACE inhibitors. C. Calcium channel blockers. D. Correct answer A. ACE inhibitors. Rationale. ACE inhibitors work by blocking an enzyme that narrows blood vessels. This vasodilation reduces the pressure the heart has to pump against, thereby reducing its workload and improving its efficiency. I hope this video gave you more confidence in understanding heart failure. Don't forget to like, comment, and subscribe to our YouTube page @StudyNurseIQ for more simple, nursing-made content.